Thanks, Peter. Delighted to be here today. My name's Annette Schmiede, and I'm in the role as CEO of the Digital Health Cooperative Research Centre.
You certainly are, and good friends of Talking Health Tech, and I've learned a lot in my time about the Digital Health CRC because I was well familiar with its existence, but then I had to go and Google what a CRC was, and then I had to try and work out where in the ecosystem it fit, and I've got a good understanding now, but I'd love to get your take because I'm sure there are others in the ecosystem that know of its existence, but not quite sure where it fits in the ecosystem.
That's a great question, and I'm delighted to answer it because, you know, when I came into the role, I was aware of what a CRC was, but really getting under the hood, taking on that role, it's a really interesting program. It was established over 30 years ago by the Hawke government, actually, and it's one of the longest-running programs that the government supports. We sit in the Department of Industry, Science and Resources, so we're not in healthcare. Funding's coming from there. And it covers all parts of the economy. So it does mining, manufacturing, climate change, space. There's probably been about 400 of them since over that 30-year period, and at any one time there's about 25 on foot, and we're one of those. There's been a number in health, but not a huge number. And the two of the, I guess what they call their success stories is ResMed and Cochlear. Yeah. So they both came out of this program. And what's really unique about this program, and I think it's where the magic is that it's bringing industry, academia and government together to basically accelerate research, implementation and translation, right? And it's not easy herding all of those. I mean, we have over 60 participants. We have 16 universities. We have a large number of industry partners, the largest being digital technology industry. So the largest is Telstra Health. We've got Alcidion, Harrison AI, Propel AI, Five Faces. So it goes the whole gamut of large through to smaller. I won't say startups. They're a bit more than startups, but they're maturing startups.
Yes.
So that's the tech industry. And we have every state health department, bar Tasmania. We have the Commonwealth Department of Health as a project partner, and we have a large number of public, local health districts, HSSs, public-private, rural, remote. We have a number of PHNs, industry associations, you know, quite a really extensive list of everybody that what I would call makes up the healthcare ecosystem and the digital health ecosystem.
Yeah, and the when the Digital Health CRC was established, or going along that pathway, because it's such a tricky challenge in terms of bringing those different stakeholders together, it's a really important one. But I from the outside wasn't noticing a great deal of kind of that impact, or you don't see the Digital Health CRC in the really early days of its existence. In the past, from my observation, 6, 12, 24, over the last couple of years in particular, we've really seen fingers in many pies or involved and are kind of at that forefront. Like, what's from your? I'd love to learn from you about, like, from your side, like seeing that where you've come in that space, like coming into that environment and then to where we are now, what that's been like.
Look, it's been a bit thrilling, actually. This is my first CEO role, which is really weird, at the tail end of my career.
You're doing well. I wouldn't have thought. There you go. So.
But I've done a lot of other things.
Yes,
I mean, I've had a lot of positions. I've chaired a lot of boards, so I've had a lot of CEOs reporting to me. Yeah. So I know what a good CEO does and what a not good CEO does. Hopefully I'm in the first category. But yes, I mean, the CRC model, I guess, is unusual and it's time limited. So the funding is put in by the participants. So in this case, for our CRC, the universities and industry put in $55 million. The Department of Industry matches that. So that's $110 million worth of funding we've got. And the funding gets allocated. A lot of it gets allocated to the research budget, right? Because that's the big driver of us. But we also have a big education and capacity building program. So you've worked lots with Dr. Mel.
Yes.
We have 50 PhD students graduating next year. We have 40 high degree students, lots of interns, building capacity, and then there's a commercialisation to the program. So bringing that all together and starting almost from scratch, which is what the CRC's, the model is. You have to, employ people. You have to get everybody on board. You have to develop a research plan. There's a lot of work in those early years. that goes into, I guess, establishing strong foundations. And I think with this Digital Health CRC, we got caught with COVID, right? You can't do much health and medical research in the middle of a pandemic. That said, we did, but it wasn't, in requiring, that actual involvement with the healthcare sector because they were so I guess, distracted with dealing with a pandemic. So there was a little bit of a hiatus. So when I came in, we had a little bit of catch-up to do. So we hadn't allocated quite the budget for the research. I also identified the role that the CRC has in growing the industry sector in which it's involved. So this is another unique element of that model. And I really kind of got drawn to that because I thought, we have a big issue in Australia with falling productivity, and we're sitting really right down the bottom of the productivity in the innovation league tables, right? So a lot of government talk, a lot of investment now going into, I guess, building the economy, complex manufacturing, all of that sort of thing. So, we hear a lot about the promise of digital health technology and how Australia could be a leader in this space. But, getting that support for industry, the private sector, it's hard. There's bringing academia and industry together, the research community and industry takes a little bit of, I guess, fine-tuning and nurturing. There's a bit of hesitation. The procurement rules make it difficult for also industry to engage with the public system. So we are able to bring all those parties together in a safe space, right? And that's when the magic happens, right? Some great examples. We've got a project going in Melbourne with Peter Mac and Propel AI, which was a spin-out of Max Kelsen.
Cool.
And the senior clinicians at Peter Mac say this would never have happened. The work that's now going on in bringing disparate data sets together across all the cancer use cases and now being looked at through AI. What are some of the learnings that are coming out of diagnostics, treatment, models of care? That would never have happened if industry and the hospital hadn't been able to work together very closely.
That's an amazing example. That's I'm looking forward to diving into that a little bit more.
Well, we should do another session. Some of our projects. That's what we should talk to you about. Bring some of our projects. Fantastic flagship project in aged care, which is going to, it was called out at the Royal Commission into aged care as the only research project they called out as an exemplar of what should be happening in the aged care sector. Len Gray's your neighbour down there, so you could talk to Len about that.
We can pop by later. But we're going to have to wrap this conversation in a sec. But given that trajectory then and some of these great use cases, and we're in the most exciting industry in town at the moment, so a lot happening and that engagement from those different partners too. What's going to be keeping you busy, Annette, over the next kind of period that you
So we finish in 2026. We've got December 2026 is our finish date. So that's just a little over 2 and a bit years,
Wow,
Nothing like a bit of a tailwind.
So between now and then, what can we look forward to seeing?
Look, I think we can look forward to, we're moving into what we call our translation and commercialisation phase, because one of the other, roles that the CRC has is to look for the opportunities out of commercialisation, right? Once again, to support the local industry. So, this is once again a complex area because you've got issues around IP and, the roadway or the roadmap to commercialisation is long and winding. And, companies can take them 10, 20 years to really hit their stride. Then you said great examples like Harrison AI who have taken off remarkably. So we've got work to do now coming out of some of our flagship projects. Aged care is one of them. The one I just talked about with Peter Mac. What's the, commercial opportunity here now for Propel AI to take some of this technology that they've developed to a wider audience. So we'll be concentrating on that. But from a bigger picture point of view, I think what we want to do is really be supporting the federal government, the Department of Health in Canberra, to provide the evidence base for some of the policy that they're looking at developing and have developed, and encourage them to, I guess, take some bold steps in legislating some of the things that we know we need to legislate, interoperability being one of them, minimum standards, a whole range of things that are on the runway, but we just need to get them, into flight.
Yeah.